Hi, I'm Katie, EleMental Health's AI guide. This guide has been created to help make your experience as smooth as possible. We have worked hard to create a customized, private, and high-quality experience, focusing on the things that matter most to our patients. To establish care, you will complete a consultation and screening process with EleMental Health, both before and after completion of your ketamine course. These treatment options may help individuals with refractory depression, anxiety, PTSD, and suicidal thoughts. EleMental Health monitors your progress through clinically validated screeners, such as the HAM-D, PDQ-9, GAD-7, and CSSRS. We use the PCL-5 for trauma. We will provide a copy of your results to you and your mental health provider upon completion of your course, and go over these in a phone follow-up. Most course options are between 6 to 10 total sessions. For some patients, a late response course may be added. This is best for cases where some improvements have begun, but you have not quite hit the threshold for symptom relief, and is done by adding an additional 4 sessions. This option may also be used to ease the transition to maintenance or booster sessions. The most common ketamine dosing for mental health series is 0.4 to 1 mg per kilogram over 40 to 50 minutes with a gradual dose escalating protocol as tolerated. Pain patients will go through a provider consultation process and require 5 to 15 sessions that range in time from 1 to 4 hours. These are tailored to the individual patient, and your custom care plan will be discussed with you by your clinicians. Pain dosing is commonly 2 mg per kilogram or more, based on patient tolerance and diagnosis. We do have an internal success rate of around 80% for most mental health conditions and 50% for pain conditions. We do not offer refunds for completed sessions. Given the variable and multifactorial nature of non-ordinary states work and individual psyches, we cannot guarantee experiences. The clinic can control setting, safety, dosing, monitoring, and recovery time. We cannot control how you experience your own psyche, or what comes up for you in a dissociative state, or if you enjoy or achieve a pleasant dissociative state. Non-ordinary states of experience create a unique way for you to interact with yourself. Most patients have experiences they find tolerable and pleasant. We recommend preparing for your sessions. Should you have a difficult journey, please view this as information. It is insight into your own psyche, and you can and will get benefits from all session types and all types of experiences. We can adjust many factors to help optimize your sessions, while we strive to make sessions as pleasant as possible. Please keep in mind that regardless of the type of experience you have under the medicine will go to work healing neurons, reducing inflammation, and increasing neuroplasticity. Every dose we give is doing what it is supposed to be doing within your body. Experiences will vary. Every session will be different. Every session is still doing work towards healing. Before arrival, there are many things you can do to support your session experience. We recommend scheduling on days you can devote more time to healing and are in as good a mindset as possible. Light exercise the morning of sessions helps with pre-experience anxiety, and doing restorative things like meditating, reading, coloring, walking, or resting are recommended. Please try to hydrate before and after sessions with 24 to 30 ounces of water with high-quality electrolyte solution. This will help you to process and clear the medicine and shorten your recovery time frame. If you are prone to nausea or motion sickness, you may take over-the-counter meclizine before you arrive. IV placement is easier if you are warm. If your hands tend to be cold, try wearing some gloves on the ride to the clinic, or taking a bath or shower or quick walk shortly before your arrival. Please abstain from alcohol and illicit drugs for at least 24 hours before and after treatment, as these can magnify side effects and impact the quality of your dissociative experience. Please arrange transportation home. Do not drive for at least 12 hours after your treatment due to potential drowsiness, disorientation, and impaired coordination. A responsible adult should drive you home, and ideally stay with you for the first 12 hours. Many people wonder what to share with their family and loved ones. This is up to you. Family members tend to do well if they know to allow you a little grace, patience, and time to heal throughout your course. This is a safe treatment option that is gaining widespread acceptance. Be patient with yourself. This is a marathon, not a sprint. Anything you can do to help your own health will help. A clean diet, good sleep, adequate hydration, and taking time for things you enjoy will all help tremendously throughout your series. We suggest just taking it easy through your series. Don't start or stop a relationship, take out a loan, quit or start a job, or make any major decisions during the process. Allow yourself time and space for gradual and sustainable changes. You'll have a clearer head and better emotional state if you can wait to make any of these life-altering decisions until after you've had some space from your course. You can help your session experience by reviewing the Orientation to Journey Experiences guideline with your support person. The two most impactful elements that come into a session are the set and setting. Set refers to the mindset you are in when you come into sessions. If you can optimize your mindset before you come into clinic, it will improve the quality of your dissociative sessions. The second part is the setting which the clinic provides. We offer private rooms with weighted blankets, custom lighting, music, headphones, and eye masks. You are also welcome to bring things that bring you comfort. You are monitored both via video, which is live feed only, and central vital sign monitoring. Vital sign monitoring can be seen in a few places throughout the clinic. Traditional non-guided sessions tend to be quite introspective by design, and are medically monitored with staff immediately available, though not necessarily in the treatment room. For a higher level of guidance and insight, we offer one-to-one ketamine-assisted therapy packages that are available through a variety of skilled professionals. Sometimes, as emotions surface to be processed, people experience emotional lability. We offer complimentary group support, virtually, every month and encourage ongoing attendance. All rooms have seating for a support person of your choosing, and the clinic has an open-door policy, which also allows you to bring your own therapist. Our staff staggers patient starts by about 30 minutes, allowing us to be present through key portions of the experience as needed, while also minimizing cost to our patients. We typically staff with a clinician and 1 to 2 admin and an APRN. Later evening staffing does often go down to 1 provider as the day is wrapping up. We are a dissociation-based rather than weight-based clinic, which allows us to individualize a custom approach according to the varied needs of our patients. This helps ensure the best results and highest quality sessions possible. Dissociation is a known effect of ketamine, and this state has been shown in research studies to be therapeutic. This effect occurs on a spectrum, and is related to the dose of ketamine administered and your individual metabolism. We cannot guarantee the quality of your dissociative experience because it is individual to you. We do guarantee you can have that experience in a safe and supportive setting. In this altered state of consciousness, you may experience dizziness, somatic sensations, a lack of coordination, visual hallucinations, memory recall, potential emotional release, ego dissolution, or in some cases, a difficult experience. Most people experience light visuals and feel a bit disconnected from their body. These effects are typically well tolerated. For most session types, you are monitored throughout your treatment and for a short period afterwards. Our standard of care is to monitor you until your vital signs have returned to within 10% of your baseline, and the medication is wearing off and past peak effect. Times may vary. We do treat several patients on any given day. Symptomatic patients may be monitored more frequently. Healthy patients may be monitored less. We adjust monitoring frequency to your condition, comfort, preference, and response. We cannot guarantee you will have one-to-one medical staff, nor that your session will be free of noises generated by other patients. You are welcome to bring your own support person, and we do offer headphones by request in the clinic as well. You are welcome to stay in your treatment room until your session time frame has ended. If you have a clinical need to stay beyond this time frame for your safety, this is honored. There are many types of touch to consider when in a non-ordinary state. Safety touch is required touch, and may be used to keep you physically safe, such as helping you walk, preventing injury, or blocking unsafe exits. Consent is implied as part of treatment. Therapeutic touch is optional and based on your preference. Examples are hand-holding, shoulder support, and touch occurring below knees and below elbows. You may decline or define boundaries prior to your session. Touch agreements cannot be changed during a non-ordinary state of consciousness. Unacceptable touch. Sexual or violent touch is not tolerated by either patients or staff. Violations are immediately actionable. Ketamine can be mentally and emotionally taxing, and the brain needs time to process the experience and rebuild neural pathways. Please limit responsibilities after sessions for the day. What should you do if you're not feeling better? Patience is key. Growth takes time. EleMental Health is not a 24/7 crisis center. We are an outpatient clinic and only available during normal business hours. If you become suicidal or need acute mental health care, please call 988 or 911. Visit your nearest ER or contact your established mental health care provider. Sometimes thoughts, feelings, or emotions that you may not have been able to adequately process or clear in the past can surface as they are working their way out. This is normal. It will pass. Good things take time. Difficult experiences are not bad. They do not mean anything went wrong. They are an anticipated and known part of this process. The best way to process a difficult experience is to use integration or therapy coaching, and return to clinic and have a gentler safety session. A safety session is typically a lower dose to reestablish comfort with this medicine and the dissociative state it induces. Just because you have a rough session once does not necessarily mean it will come up again. Please trust that whatever surfaces in a session is what needs to come up. Early on, sessions can be more somatic or body-based, before sessions begin to feel easier and more comfortable. It takes time for your psyche and body to become adjusted to this experience. You aren't the same person coming to the clinic twice. No two sessions will feel exactly the same. Your body is healing. Please treat it well. By the time you leave the clinic, nearly 90% of the ketamine is out of your system and will continue to be metabolized. Any healthcare issues that present after your discharge from the clinic should be addressed with your regular healthcare provider. Mental healing is a marathon, not a sprint. Please pursue mental health resources in whatever form feels right for you, and reach out to EleMental Health staff when needed. We are here to help, and thank you for trusting us with a small part of your journey. We welcome your feedback. Thank you for choosing EleMental Health. Should you have any additional questions regarding this treatment, we are happy to address these in a complimentary consultation and can be reached at 208-801-1414.